Winslow's definition of public health, it defined public health as the science and art. So it's not just a science, art is a huge part of it. So the science and art of preventing disease, promoting health, and prolonging life through organized efforts of the society. So if you look at the first chapter in Park, you will look that there is something known as deep professionalization of medicine. Okay. So where we envision that, okay, doctors are required when you're trying to treat a disease. But when we are thinking of healthcare in general, when we are wanting to address the aspects of healthcare, that is, we are trying to prolong life, we are trying to promote health, we are trying to make people behave in a responsible and healthy way in order to prevent the occurrence of disease in the first place. Those are not things that cannot be done by doctors alone. They require organized efforts of the society, as in they require investment and participation by every section of the society. School teachers have a role in that, doctors have a role in that, nurses have a role in that, the governing bodies, the prime minister, chief minister, they have a role in that, the panchayati raj institutions, who are the local governments in the rural Indian setup, they have a role in that. So the society as a whole has to come together for this to be possible, for health care of the community to be successful. And while the medical decisions or the healthcare decisions that will be taken, like, okay, what they exactly have to do, what they exactly have to eat, while those decisions in terms of maybe the nutritional parameters, how much of protein, how much of carbohydrate, how much of fat, that will be decided by the science behind it. But at the same time, the cultural aspects of that society, the living conditions of that particular society, their cultural aspects, their beliefs, their choices, the locally available foods, and all of that is going to play a huge role in contextualizing that science into it actually improving the health of the community. And that is where the art comes in. Okay, the art of conversing with people, the art of understanding people, the art of understanding the cultures, beliefs, backgrounds of people, and trying to contextualize the science to their realities in such a way that it ends up making sustained changes and developments in their life. Okay, so as you can understand from this, that public health is definitely a multifaceted endeavor. And this multifaceted endeavor, it encompasses various aspects of improving health and well-being in communities and population. So Winslow's definition is basically laying the foundation of that by saying that, okay, we require organized efforts of the society and the community here. Okay, so throughout, as we go forward, we will look at the levels of healthcare, and we will also try to understand how the community plays a very, very vital role in the public healthcare system.